Hello again. Good morning, good afternoon, and good evening. My name is Dr. James Ong, and I'm your host. And today we have a very special guest with us. Very special. And he's a neurologist as well as a neurosurgeon. And his name is Dr. Let me get this right, Raafat Ibrahim. But he would like to be known as Dr. Ray. Everyone calls him Dr. Ray. But before I introduce Dr. Ray, well, let me just give you his background information and resume, which is gonna blow you away. I'm sure, right? It's gonna blow you away. So here we go. And it's quite lengthy. And I know that this live stream will be recorded, so you can play this later on. And look at the medical achievements of our special guest today. And I'm just going to go through it slowly. And this is how cool he looks, all right? And I love his sunglasses in this photo. And he's three nationalities, Egyptian, Australian, and Tonga, all right? So before I introduce him and call him for this interview, he has all these achievements that I feel people need to see, all right? It's just quite amazing, all right? So here we go. It starts from here. As you can see, I'm trying to scroll down as slowly as I can. So it starts with stroke. I just can't read everything because it's just too much, all right? So whatever problem you have, just see if you can identify with what is being written here, okay? And here we can see total patients, 16,440. He updates it every month, all right? That's what Dr. Ray was telling me. And well, he practices alternative as well, all right? And later on, I'm gonna ask him why, okay? From a neurologist and neurosurgeon, why he went into alternative and specifically into frequencies, all right? Which is more exciting for all of us at iTeraCare and Prive International. All right, so the list is still very long, guys. So, you know, I'm just going to slowly scroll through this so that you can watch this again if you miss out, but it's a lot. There we go. Another 19,363 patients. And, well, the list continues, all right? And from diabetes, 8,000 plus patients, and it goes on, hepatitis, and yeah, cancer, and it goes on. Another 19,413 patients, and ear infection, 2,000 plus, eye, vision, right? It's just far too numerous for me to read out each and every one of them. Here we go, another 12,717 patients, and some more, right? From urinary tract infection to all kinds of different problems, all right? Another 18,059 patients, okay? And it hasn't ended yet, all right? So here we go. And look at that, shoulder dislocation and different problems with the knee and everything. Wow, there we go, from rheumatoid arthritis to, these are all very common problems, right? Another 23,891 patients. And there we go. I think we have reached the end. 109,889 patients. I hope that is the updated version. And can we please welcome Dr. Ray Ibrahim? Please unmute yourself, Doc. Right. Welcome. How are you today in Tonga? I believe it's pretty late for you right now, right? What time is it now?
Yeah, it's 1:35 a.m.
Oh, wow. Thank you so much. Thank you so much for staying up so late just to be part of this live stream. And I'm sure our viewers will appreciate you as well. So I am going to start this getting straight to the point. A neurologist, a neurosurgeon. Why alternative and why frequency? Can you enlighten us, please?
Okay. When I studied medicine, I found like I have one leg. but God created me with two legs. And there is some argument between the Orthodox medicine and alternative medicine. And lately they start to get like some dietitian, nutrition to the board. But still there's some argument there. Everyone try to improve his right, like I'm the right, you are not, or I'm the right and you are not. But again, this type of argument let me know, like when I have a patient with nerve damage or patient after surgery, they need a proper diet. So from here we are, I want to understand what's going on. So because sometimes when we wrote or when we prescribe medication to a patient, and this patient just go and eat whatever he want or through Google, that can cause interact to the medicine. So from here I said, okay, I need to study natural medicine. So
Okay.
I want to go deeper. So I studied natural medicine. I studied natural medicine in Australia, but in Egypt I studied the Orthodox medicine.
Yeah.
So
And what year was that, Dr. Ray, when you studied alternative medicine in Australia? What year was that?
That was in 2013.
Okay.
But between 2013 and 2000, this is a big gap for me. But this gap, what happened in this gap? Because this one is just like, you know, when you have like a shocking, like thunderstorm come to you. Sometimes when we look to the MRI, okay, we can't even diagnose. We don't give a proper diagnosis, so we need further scan like EEG scan or EMG scan. What the different thought of this? It actually measured the frequencies or the electricity inside the brain to the brain, or from the brain to your body, or they measured the nerve message from the nerve to the muscles. Okay, but if we go back to the roots, all right, what is the roots here? I have vitamin D. Like if I have the nerve there, say like 1, 2, 3. So what happened here? I have like sodium, potassium. I have negative and positive, positive and negative. So the negative tried to go inside to the negative, and the negative tried to go outside to the positive. So when it's come like this, vitamin D, close, then open, then close, then open, then close. The speed of the nerve message actually how strong your vitamin D in your body. Okay. And vitamin D go play roles to different cells in our body. And from there, I said, okay, I have vitamin D responsible for most probably nerve damage. Okay, when people have vitamin D deficiency. I'm not talking like for everyone to take vitamin D, okay? Because I'm very specific, because people nowadays like, oh, he said vitamin D. No, because some people with some health issues, vitamin D, it's not good for them. Okay.
So no two persons are the same, right? That's what you're saying.
Yeah.
Yeah.
So because some disease, vitamin D is so not good. I'm not saying dangerous, but it's not good. Especially when people, they took medication to lower their immune system for example, like when they have a kidney transplant. So when people have kidney transplant, vitamin D was not good option, because vitamin D, it's actually get your immune system work faster. So for some cases, we need to be careful for what we've been saying.
Yeah.
Okay.
So why frequency? I mean, why the study of frequency and the belief in frequency itself?
That is very good question. In 2002, I was in seminar, and they talk about the frequencies. That's the revelation of the medicine in the future. And in this seminar, I remember when they said in the future, no one will need to take a medicine. And I said, like, what? This is a crazy people. How come? Like, I've been in study like 6 years and 1 year, actually altogether 7 years.
Mm-hmm.
And you tell me in 2002, all this will be like disappear. And I said, okay, I will go to this one. But what I found is so amazing. When we study anatomy from the cells. So each group of cells, similar to each other, come together and make a tissue. And then similar group of tissue come together and make an organ. And then similar group of organs come together and they make a system. But for me, what is make the cells? You know, the chicken or the eggs.
Yeah.
And then lately I found, wow, the molecules create the cells. The molecules create the water. The molecules create the tree. The molecules create the brain, the heart, the kidney, the skin. And this for me makes sense. Makes sense. You know, when you prescribe a medicine, we have like over-counter,
Yes.
right, which is safe to take, all right? And we have listed medicine. So that's when we go to the highly drugs, okay?
Mm-hmm.
So when we go there, actually it's chemistry, biochemistry. When you look for example, like uric acid, okay, the chemistry or the equation of the uric acid or the equation of the arthritis or rheumatoid arthritis or the equation of gout, all right? How you break the gout, the equation. So with this equation, we got the scientists come together and create another equation. So when you take the medicine, so this medicine go inside you. So we have like negative and positive. So this one try to break the equation of this one, and that's how you heal. Okay, this theory. Okay, in medicine we work in theory. There is no 100% fact. What we're using now maybe tomorrow is wrong. Okay, when you get sick, you go to the doctor will tell you 1, 2, 3. You go to the other doctor will give you another thing. Say, doctor, because the end of the day, we are different school, okay?
Yes.
And we are different school, different beliefs. But the end of the day, you have to have your reference, because your reference, that's your guideline. Or for example, when you treat a disease, what is your guideline? What is your protocol? So even the guideline is different between country to country. Like cholesterol, okay? When you look to the USA, the guideline is different than Australia, different than Egypt, different than China, different than Japan, different than India. It depends about what is the guideline there. And then from the guideline, you have a protocol. And this protocol different between country to country. But guess what? Even the frequencies and on the earth is different. You know, if you live in Ireland, like me here, actually the frequencies is less, the gravity is less. But when you go more deeper to big country, to the desert, which is the frequency is different. So even the frequencies is different in our body. See how it's amazing?
Absolutely. Agree with you.
In 2002, what is really surprised me was first time for me in my life to see a video from one sick and one normal in the same area. And I saw saw in my eye how the atom move inside the cell in the normal person and move inside the cell in the sick person. And now go back to the definition of disease. When I say disease is cells disorder, this cells disorder caused by what? Maybe by accident, maybe by DNA, maybe by virus, viral, fungus, chromatosa, whatever is listed, okay? Sometimes even by wrong diet.
Yes.
But at the end of the day, name as cells disorder. But what I saw in 2002 for this video there, I found the electrons, they moving, you know, in chemistry, or when the atom lose power, lose energy, the electrons start to get like less, and sometimes like go from out shell to inside, to inside, to inside. And then I said to myself, there's something going here. So if I give the people, for example, what they need in this organ there, what will happen? So from the alternative, and that's like I didn't study yet the alternative medicine, but I was following with my dietitian when I referred my patient to them to put them a diet. I was asked, like, I'm on the top of their toes. You know why? Because we have something called when the patient come to me, right, he's under my name, okay? So at the end of the day, if I refer to him to dietitian, which is in this time, I want to see what the dietitian do. See this argument? So if we give 1, 2, 3, I have to go there and see the interact between what he gave or what he gave diet to my patient and what I prescribe medication. Okay. So we call it like duty of care. Okay. For me as a doctor, my patient is under my duty of care. So when I refer her to a dietitian, which is list level, I'm in the top of the toes of the dietitian.
Yeah, I'm legally trained, so yeah, I understand the duty of care, which leads to negligence if you're not careful, right? Now,
and then and then what happened here? I've been in 29 countries, actually, from Egypt to almost 18 countries in the Middle East. I saw a lot of patients with multiple sclerosis, MS. And then from there, I start to get my idea from there, how the message go there. And when we go to the MS, the multiple sclerosis, we have a damage in the myelin sheaths, okay? In 2012, they discover this myelin sheath actually damaged by bacteria, but before 2012, it's unknown, okay? But at the end of the day, there is a message there, electricity, frequencies come in a wrong place. Like if I have this cold and I have cut there, and this to electricity, if I put my finger, I get the shock. And that's what happened. Our body work in frequencies. Then I start with the PEMF, electromagnetic pulse. And then I go through from the EMG scan, I go through something called in bioresonance, something called stimulation muscles. And this will help people with a stroke. And then this year,
iTeraCare.
oh my God. Yeah, I tell you what happened.
Tell us about it. This year, which month?
Look, this year I have the volcano and the eruption. Okay, and I don't know why I'm still alive, but for a reason, because for me, after the volcano and the eruption and then the tsunami, was very bad experience, but I was seeing the massive frequencies in my brain, never deleted in my life. But after that, After that, I have Lynn from America
Mm-hmm.
and Emilini.
Mm-hmm.
In this time, I was doing charity work with the Tongan World News and UNIBEF. So after the eruption, Lynn was introduced, iTeraCare, and then Emilini told her, wait, I have Dr. Ray. So so they sent me the device.
Mm-hmm.
And when they talked to me about the device, I questioning them for every single part. Because, I'm very hard believer. Like, show me where the screw went, and I put my finger to believe. Yes, I've been questioning them about this device. And then when I received the device, it's not went like this. I asked them for the paperwork. They send me the paperwork. I've been read the paperwork for the device, and I go through each single line in the paperwork and this device. I think maybe they told you. Oh my gosh, I go through one to one to one. Then because for me, here we are. When we talk about the terahertz, actually it's not a microwave and it's not infrared. It's in between, you know. And when I talk about in between, it's not about between and that's it. Because in between it starts from 1 terahertz to 10 terahertz. Okay. And when I talk about 1 terahertz to 10 terahertz, that's all the frequencies from the brain cells to your toes, to your hair, to everywhere when I talk about this. Because terahertz, actually, that's like the 1 terahertz, that's like 1,000 gigabyte. If I make it like in this way, but with the frequencies, when I have from 1 to 10, that is awesome, awesome. And the person he created the device, actually, I don't know from where he get this idea. I thought I'm the craziest one in bioresonance. Okay. Yeah, to be honest with you,
I know.
I can go from here to 10 years and ahead, talk about frequencies. But what happened here? He used the power, like when we go to quantum science and
Yep.
quantum technology, there is two different.
Yep.
But how this guy is smart, I don't know who's this guy create this device till now. I'm sure. But when I see, if in the future I saw him, I will kiss his head. I promise.
He's amazing,
Okay.
man. Yeah, he's amazing.
He is. I told you, I will kiss his head. He deserve it. He
Yeah.
deserve it. Let me explain to you how here and how he's smart in physics, reflect to chemistry, to biochemistry, to stem cells, to our body. Okay, this is the most important. So when we talk about this device, actually he uses power, which is voltage or watt, goes through there, convert it to light, which is actually there is some antenna inside the device, which is I looked where, and then the light comes through and then goes through crystal, and this crystal I found it's made of format of nanotechnology. See how it's going now. So he get the quantum science to nanotechnology to biotechnology, quantum technology. So there's something in between there. And that's what he's smart there. He used the quantum science, nanotechnology, to give us this type of quantum technology, which is called terahertz, between the microwave and the terahertz. What is the difference here? The microwave actually heat from inside, which is so dangerous, from inside to outside. So if you have a frozen meat or dish, or you put it inside, you actually see the middle is hot, but still outside is frozen. Different type. When I go to this one here, from 1 to 10 terahertz, you can use this device for meditation. You can use this device for yoga. People go for meditation and blah, blah, blah. they spend a lot of money. But this device, the range of this device, actually, if someone, you just sit and he will do the meditation with this device, with these frequencies. If you look for stress, for example, you know, if someone have stress, anxiety, depression, they play music, and the frequencies from this music start from 30k hertz,
Yeah.
or 30 hertz, 380, sorry, from 380 to 680, okay, or to 640. It depends about how his stress and anxiety and depression. But here, with this device, you just need to go from this to this to this to this to open the range, and from this area to this area to this area to this area to this area. Man, you can do meditation, you can do yoga as well. Okay, how this amazing. Okay, in the meantime, it's not about meditation and yoga, and actually these frequencies go there, you know. And one most thing there, when I use frequencies, back again to the diet, back again to the doctor. Okay, it's good when I don't say like it's because I did it, but for me, I understand the three different things. I use this device for people in UK. They have knee replacement, like they going to have a knee replacement. I use this device there, and they walking now. There is no need for knee replacement. I use this one from one in Australia. They have a knee replacement as well. No need for a knee replacement. It depends about it. Like here you have 1, 2, 3. Okay, it depends about how you use the frequencies, where, and the space and the distance. I tell you, this one here from 1 to 10, it's a huge, covering everything. When we do, we have the body chart of frequencies. Like we have the brain, we have the eye, we have the heart, we have the liver, we have the kidney, all these different type of frequencies. Okay, like for example, when we talk about intestine, okay, so the intestine frequencies between 70 to 76 frequencies. So from here, you can go to the first one, okay, and the distance will be like maybe around 5 like this away, which is like maybe 10 inches away from your stomach. But you need to have the stomach empty, like 1 hour before, 1 hour after. Otherwise, you will have a massive stomach pain, and cramp even can go for 2-3 days. I'm telling you, I have a lot of people suffer from this, but I advise them that. With the range of iTeraCare, when the people are charging the water, actually now the water is charged like energy. The water is negative ion, just like
tell us about this water and what you can do to your skin, to your body.
Yeah, I tell you what happened here. So for me, actually, I do safety. Okay, for me, when I use from the side, not from the top. Okay, safety is number one, because if you use it from the top, the water will be like boom. And what about if this device drop from your hand to inside? So for me, from inside here, from outside, which is for me, it's good, because the people put the air condition in the high place, not in the very low. So when you do from the side here, actually the hot will go up and the cold will go down. So the water charge will go up and the low frequencies will go down to be charged again to the top. So after that, I ask the people to put like the water inside, okay, spray, and then spray the body. Spray the body. When they spray the body, I ask them to use iTeraCare and each 2 minutes or 3 minutes spray the body, because that's actually the water here. When you spray it, it's negative ion. And now when you use the iTeraCare there, the frequencies push the negative ion very fast to your bloodstream, very, very fast. I have this two patient. One, she's hair, foot, black, and she's been like 15 years from the doctors, and they told her they can't do anything. It will be the rest of your life. When she came to me, she sent me the photos of her leg, and I told her, okay, we'll do Doppler. So I ordered a Doppler scan for her, and I looked there with clots. The clot frequency is actually like, we talk about 2 to 4 kilohertz, not even terahertz. So I told her, I want you to spray the water in your black foot and use iTeraCare. And now her skin is normal, back to normal. I have another patient from USA. She has herpes disease and a lot of skin issue. And I asked her to use the same spray and use the iTeraCare frequencies. And man, you know, within 2 days, she called me. She was so happy with the skin. She said, oh my gosh, I never even feel my skin start to like this from 1994.
You know, this is the first time that I'm hearing someone spraying the energy water that you use the device to blow on the water first and then put it on your skin and then blow again on it to because of the negative ion, as you mentioned. So the effect is much faster. It goes into your system much faster. This is the first time. I think our viewers, they're hearing this, I think, for the first time too. And that's really interesting. And thank you so much for sharing that. Now,
yeah, go ahead.
Yeah, go ahead and tell us more. Yeah.
No, I tell you, because for me, when I spray the water, because before I advise my patient, like each 2 minutes, they need to drink water. Each 2 minutes, they need to drink water during the session of this device. Why? Because here we have sort of heat, all right? So what happened? In our body, we have 27 different type of fluid in our body. Like your saliva, it's type of fluid. Your blood, your plasma, your semen, if you're a man, if you're a woman, you have the eggs, all these different type of fluid in your body, okay? But what happened? We have this 27 different type of fluid. We put it in 3 branches, one called isotonic, hypotonic, hypertonic. All right. So for me, if you use more heat here, what happened? That can cause even the fluid will be inside the cell to go out and will be like dehydrate. So I want to keep more water to drink inside the session. You know, like when you go to gym, you start to exercise and you drink more. Otherwise, it will cause more. Yeah. So I started from this way. Then I was playing with the device and I did it for myself. So what happened when I spray and I use the iTeraCare, I tell you, after I finish like 5 minutes, the frequencies, I still feel it in my skin for another 1 hour. Like I feel like something like tick, 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 tick in my skin. I'm always do it in myself first. Okay. Mm-hmm. I never advise my client to do anything without I try it in myself.
Yeah.
Okay. Because here, when you advise someone, you're responsible for your advice.
Yes, duty of care. We just talked about it. Yeah.
Why I said that here? Because I have one actually two very serious condition or patient happened. This person, he got iTeraCare, and he was looked for the Google. He have a stage 2 prostate cancer since 2019. So sound like his prostate cancer is stable. It's not go up, but it's stable since 2019 in stage 2 prostate cancer. And he got the device. And after he got the device, he was in pain. Went to the doctor, and suddenly stage 4 cancer. He contacted me, and I said, okay, mate, settle down. I spent 1.5 hours asking him every single question you can come to your brain, from where it starts and how it starts. If you have any family history, he sent me all the blood tests, okay, even the trauma count or the trauma marker. He sent me everything. I've been looking, try to understand. Then I told him, okay, I want to explain to me, if you take any supplement, if you take anything, just tell me. Now I look for his food is so healthy. Okay. Then I said, okay, I will look for the supplement. But see how now, what will happen? He found in Google that the milkshake protein is so good because he want to put muscles. Okay. And he found that the protein is good for the prostate. I don't know from where he get this information. Then I told him, okay, when someone have enlarged prostate, not even prostate cancer, when someone have enlarged prostate, we eliminate the protein. So now you take protein, and now you use the iTeraCare. Can you tell me how you use it? And I found it like he use it like 4 hours a day. Like every time he have time, he just get it and bang, bang, bang. I said, no, that's not a toy. It's so safe to use, but actually, why you do that? You have to be reasonable, and you need to give your cells a time to heal. Okay. If you like listening, if you love one music, okay, and you keep play it, actually you get angry, then you will turn it off. Like maybe you will happy like 20 minutes, 1 hour, but I don't think after 1 hour you still repeat the song, because you'll get like, okay, I had enough. So you have to give yourself, your cells a time to heal, and you have to have the like reasonable advice for the supplement. So what happened here?
From 4 hours, how many minutes did you tell him to use the device instead of 4 hours, right, per day?
Yeah, I stopped the protein, and I stopped what he's doing. I just tell him to do just 20 minutes a day.
Okay.
Full stop. And he said, are you sure? I said, yes, I'm sure. But guess what? After 1 month, he sent me a big message. Dr. Ray, I have a good news. Found like 0 cancer cells.
0 cancer cells.
0 cancer cells.
Wow.
And he was so happy. And his doctor said, we need to repeat the test again. So he repeated the test again, and it's still 0 cancer cells. And the doctor said, okay, we will see you after 3 months, and like to be sure. But they surprised the cancer from stage 4 to 0. Okay. Yeah.
You mentioned there were 2 cases, right? So what's the other one?
Yeah. The other one here, she got some from the internet and relative that the calcium is good for her age. She was 81 years old, actually, no, like 84. So they've been giving her calcium oxide, calcium oxide. And then the lady, suddenly, she's sleeping more. She's in the AUTHENTICATION center. So the lady, what happened? She's sleeping more, and when they use iTeraCare on hair, like she's sleeping more and more and more, and even she's not concentrate, and the heart start to uh, beat faster. And so they tried to figure what happened. Then the relative contacted me, and I said, okay, what happened there? They said, we use iTeraCare. I said, okay, I want to go through what she eat. She didn't eat. Okay, so what happened? We just give her the minerals and vitamins. What sort of minerals and vitamins? So they just give her calcium, and that's it. I said, this can cause even stroke, and this can cause heart attack. So if you want to give someone calcium, you need to give vitamin D. Okay. If someone have issue in arthritis or rheumatoid arthritis, if you give them calcium by itself, it will make more pain. So I stopped them for giving the calcium. Within one day, the lady start to wake up and talk and start to active around. I have this patient today from America. He visiting Tonga for his relative. He's been suffering from very bad constipation. And he tried a lot of medicine. He come to me like laxative and lactose and whatever. It sometimes works, sometimes not. So I said, okay, come here. And I use iTeraCare. I use it just 10 minutes. But I told him I charged the water for him. He drink, and then I did each 2 minutes, I make him drink, have couple of drink. Man, after 10 minutes, when I stop, I told him, come and sit, how you feel? I'm feeling good. And he just, where is the towel? Man, he go there, it's just like for good half an hour, and he come and he told his wife, oh my gosh, I feel like the devil holding my stomach. He just left me alone, and God, he was so happy with this.
Amazing. I mean, you know what? Despite the tsunami, did you say? Despite the calamities, and I believe you're still here. You know why? Because the universe needs you. The universe needs people like you to help more people out there, And
I think I tell you what, I think that the universe need more people from the one he created this device, to be honest with you. Yeah, I'm serious. Like when I look to the light, how he get the light to the, you know what? This device here is THz, but guess what? He can get photon, like negative ion, and you can get infrared too as well, deep far infrared.
Oh, that's good. FIR is good, yeah?
Yeah, because this one here, actually, when it's come the light to the crystal here, actually that's give you a sort of infrared, deep far infrared.
Yeah.
But I try to configure how can I get it, but I'm almost like the negative ion now. From the deep far infrared, yes, I think it will be easy to figure because it's sort of light inside.
Yeah. Well, Dr. Ray, I wish we can continue. How time flies. It's already 45 minutes we have been talking, or rather you have been talking. And time really, fly by really fast. And I'm sure our viewers really appreciate what you have shared with them. And maybe one of these days we'll bring you back again, with more cases that you document. I'm sure you're a very meticulous person. And wow, we hope that you will be able to help more of your patients. And and it's really, really amazing to have someone like you, who is a neurologist, a neurosurgeon, to be talking about frequency, I mean, it's pretty amazing in itself. But basically, would you agree that our whole body, our organ, as you said, right, made of molecules? So if our organ, our cells are having problems, you fix the molecule. Am I right? Is that how you do it?
Yes. 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 100,000,000% yes.
Yeah.
Look, I tell you what, if you have a tree and this tree is sick, what you do? You go and put fertilizer in the roots. Yeah. So if you have something sick in your body, what you go to the roots, and the roots, not the cells, it's the molecules.
And you know, I resonate totally with you because I have been saying that the first day I joined this company in April, just the same time as you, I have been saying that. And I'm glad that now I have someone like you, right, who is saying the same thing. And of course, you can go further because you are a medical doctor and you can treat a lot of people out there. And I really would like to invite you one more time, you know, sometime in the future. And
one more thing, one
Yeah.
more thing if I want to say before we close. When the price they put the disclaimers, okay, this is very important because I found on YouTube a lot of people just advise wrong, and then they said the company said no. And I'm so happy when the company said you're responsible for yourself. Okay, but again, there's a responsibility. You know, you can do whatever you want in your body, it's your body. But when it comes to the other people, this is so way different, so way different. So even when people put like take vitamins and minerals, that can be dangerous, can be dangerous.
I know. Yeah.
Yeah. And the end of the day, can I share the university?
Yeah. I
The
was about
academy?
to ask you. Yeah, I was about to ask you. I think we're in sync here, you know. By the way, you know, Dr. You know, Ray is, if I can, and you can elaborate
Yeah.
more, is in the process of setting up his online academy. So for those of you who would like to enroll for his academy, yeah, you may do so when it's ready, right? And we'll launch it. And yeah, I look forward to that. So maybe you can elaborate a little bit and then we'll close this live stream.
Okay. We run Frequencies Academy online, so people will you'll get in a very simple way what is frequencies and how they use these frequencies in their body. And in the meantime, it's not about frequencies by itself.
You know
We
what?
have
You know what? Maybe this is timely thing to close. Let me share this. I forgot to share this today. So as you can see, right? We talk about frequency, right, Dr. Ray? So
yeah.
now
So
some of you will see this as gray and some of you will see this as pink, right? So different people will see different colors. Why is that so?
okay, for me here, the left side of the brain frequencies is different than the right side brain frequencies. And how you use if you use the left side of the brain, definitely you will see like green, gray. If you use the right side, you will see it's pink, because here the vision, the color we have something called rods and cones. So here, how your brain transfer the message from the color to your eye, it's different between person to person, even from the angle. For example, when you look to the sun, okay, the midday, it's so white. But when it's come to the sunset, it's orange. Why? Did the light it change? No, but the angle it changed. When the angle it changed, now the cones get different message. We have three colors. We have the red, blue, and green. When the red and green and blue come together, in the middle, that's a white. And then you can go to something called a rainbow.
So basically,
from this,
you get to understand more about frequency in your course, right? And also how to apply that. Yeah.
Yeah, and in the meantime, there is a nutrition and herbalist. She's from Egypt. She's qualified in Egypt as a pharmacist, and she done in America a nutrition course and herbalist. So it sounds like in Egypt we study the Orthodox medicine. When we migrate to overseas, we study natural medicine. So so she will run the nutrition
Yep.
and alternative medicine, and explain what the vitamins and minerals belong to the frequencies. So for me, I explain in the course about frequencies and the disease, and she will continue the nutrition and the disease. So we'll go like 2 in 1.
Yeah. So when you're
Like
ready,
one lecture,
when you're ready,
frequencies and disease.
we'll help you launch it. All right. So
Yeah, of course, yes. I'm hoping to.
okay.
And I
So
tell you what, I invite you actually to do some lesson with us in frequencies. Yes.
okay, let's work together. Anyway, thank you so
Yeah.
much, Dr. Ray. You have been tremendous,
You're
and
welcome.
the things that you shared is really, really, I'm sure, going to touch a lot of people's hearts, and people with different kinds of problems. Now they know what to do. All right. If they still don't know, some of them may find a way to contact you. All right. So thank you so much.
Okay.
And
Yeah.
I hope and wish the very best for you in your practice. And
Yeah.
may you
And
be able, yeah.
the frequencies will start to open to people to register on the 24th of this month, 24th
All right.
of August. So people can just apply for registration for the course.
Okay. Let us know about it. All right. So
Yeah.
thank you, Dr. Ray, and all the very best. And wow. To all my viewers today, I think you have been enlightened by Dr. Ray Ibrahim, and I hope that you enjoyed this session. And I'm sure there's a lot of information. So please share this video, after watching it, because I think the information needs to be passed around, because I always believe that no pain or no problem, or whatever small the problem may be, is too small for someone, because a guy who has a back pain who cannot tie his shoelace is a very big problem. So let's help people out there with iTeraCare. All right. Bye-bye for now. Thank you, Dr. Ray.
Bye-bye.
Medical disclaimers. iTera Classic and iTera Pro are not medical devices. The information provided on our website is for educational purposes only and does not substitute for professional medical advice. Please consult a medical professional or healthcare provider if you are seeking medical advice, diagnoses, or treatment. Praif International shall not be liable for risks or issues associated with using or acting upon the information on our website. Praif International shall not be liable or responsible for the actions, misrepresentations, or negligence of our members who are independent contractors.